Cataracts are a natural part of aging. Pretty much everybody has cataracts over age 40, whether they realize it or not, at least to some degree. And when you fix them is totally up to you. For most people, it's night driving and glare issues with oncoming headlights or sunlight bothering them, or just being blurrier and not being able to improve it with glasses. Regardless, it is a surgery to fix it. It takes about 8 minutes on average. It's a trip to the operating room. We never do both eyes at the same time. They're usually about 3 weeks apart from each other. I do have you awake because I want you to tell me if a cough or a sneeze is coming, but you're very relaxed. You don't really care what's going on because you're getting that happy juice in your arm from the anesthesia team. What are we doing? We're taking this cloudy lens out inside of your eye and replacing it with a plastic prescription lens that's customized to the length and shape of your eye, aiming for distance vision, which is what most people would want to see best, knowing that makes you totally dependent on reading glasses up close, and you may or may not need glasses for distance, depending on some of the measurements of your eye. There's a whole separate conversation I won't get into today about special technologies and lenses for people motivated to be less dependent on glasses. But once I have the measurements of your eye, I can guide you on that. Every surgery has risk. Anytime we cut on the body, there's a risk of infection. It's about 1 in 2,000 with cataract surgery, and of course we do everything we can to prevent that. Anytime I put instruments in an eyeball, I tell every single patient there's a chance of permanent and complete vision loss with eye surgery. Now, the chance of that actually happening is kind of like a devastating car wreck on the way home. And the same way that you don't worry about getting into a car, I don't want you to worry about that. Same for your heart and your lungs. God forbid they stop working on the table. The chance of that is about the same as it is right now, because I'm not having to put a tube down your throat or put you to sleep. So it's very safe for your body as a whole. I'll ask you about whether or not you've had any blunt trauma to your eye in the past. For routine cases, less than 1% of the time, it can actually take 2 surgeries to fix one eye. That happens if a piece of the cataract falls in the back of your eye. I can't go fishing for it. It takes a separate specialist on a different day to finish the job. It usually does not affect your visual outcome. It's just inconvenient to have that second surgery. As we get older, the eyelids can droop naturally. Sometimes eye surgery can speed that up. It's not common with cataract surgery, but very fixable if and when it happens. Dry eye is a condition that can be very frustrating, but very treatable. And that can flare up after surgery, but again, very treatable condition. The recovery is about 1 week of no bending, lifting, or straining, and about 1 month to heal completely for most people. I would emphasize it is an elective surgery. It does not hurt you not to do it, so it is totally up to you.